morning. Also, thanks for meeting on a federal holiday. I wanted to hold this meeting because, for one thing, we're receiving, some requests from the public that we, hold more meetings because, as I mentioned before, I think that there are people in the public who feel that this committee provides reliable information to everyone, so it serves a valuable purpose. The second thing, though, is we wanted to give all of our members and the public some important updates, and the first one is an update from Mayor Blangiardi. So, as um, the mayor for the past few weeks has been working very quietly and behind the scenes to um, see how we can reopen the economy, at least on Oahu. And I know he's worked very closely with the governor. He's been very diplomatic about it, how he's approached it. And last week he made an announcement on um, uh, reopening Oahu. So we wanted to ask the mayor if he could join us this morning and just give us an update and also answer any questions. So thanks, Mayor, for joining us today.
Oh, thank you. Thank you, Speaker Saiki. Okay, well, right now we are still under our suspension of large gatherings, which goes into effect till 11:59 a.m. on October 19th. But we did have a press conference last week. Rather than wait for that, under the circumstances where we've gotten this sort of unbelievable precipitous decline in all of our numbers, most positive in the first week of October, we asked the governor and Department of Health, said, look, we think for the good of the community, just the psychology of it all, let's not just wait for something, let's take the initiative. And that's what we did last Friday afternoon. And so we were able to get a little bit ahead of it and pretty much announced that the bars could start opening up till midnight, and that includes restaurants serving alcohol until that time. And then the 13th, which is this Wednesday, we asked for universities' purposes as well, but even other large gatherings of 1,000 people go in effect. And then on October 20th, we also got some conditions agreed to with respect to gatherings. Well, to be specific, we're signing off on road races, if you will, 25 at a time, golf tournaments. They've got to use safe access to Oahu in the clubhouse if they have a tournament. People have been allowed to play golf. But the bigger thing that we got was weddings and funerals, because we heard a lot from those industries. And we got up to 150 people outdoors because we're going to allow co-mingling, if you will, because of the dynamics of that. So we allow food and drink. But knowing that the university can at least now anticipate for the next football game, 1,000 people is good. We met this morning, and I'm going to be pushing forward because the next home game is on November 6th, anticipating that that's going to go off without a hitch, is to see what we can get. I still need the governor's permission, what they'll sign off on, but we're going to actually ask them to sell tickets for the entire capacity. And then that would conclude with the last home game against Colorado State. So the last two games of the season here to allow for maximum attendance. And in addition to that, I think I said we signed off on road races right now, but we also met last week and told the chief of police. And I also informed the governor that we think we should plan on, although we haven't announced it publicly yet, conducting the Honolulu Marathon. We're talking about also going forward, having the Honolulu Marathon this year, which we've been told over the weekend there's 13,000 people have registered as it is. So it's not going to be a small outdoor event. I think we looked at this first opportunity here because of where the numbers are and all the metrics being what they are, the hospitalizations, and I know Ray is on the call and everything being most positive. At some point you start saying we move forward. And that's kind of what we did. Friday was the beginning of that, but we met this morning and we're not going to let up on that. So I now understand the ground rules, but we're going to submit all of those plans because they do require the governor and the Department of Health to sign off on anything because we're under the emergency proclamation to November 30th. But so we're going to be pushing that. We're going to be, I met yesterday with some promoters. They want to do a New Year's Eve concert on the 20th on New Year's Eve. On December 31st with 2,500 at the Blaisdell Concert Hall. I feel like we should be able to greenlight that, at this point in time, and be able to do that. And so there are things like that that are coming up. And I guess what I'm trying to say is, that what we just did this Friday is just the beginning of where we are right now. Even though we have a while to go until the 20th, we're going to start pushing forward things that we think are going to be really healthy and safe and good for the community to plan on. And so that's where we are. That makes sense.
Okay, thanks. Thanks, Mayor.
Yeah, we're not waiting, Speaker Psyche. That's what I'm trying to say. We're not waiting. We want to be aggressive here and try to push for this, feeling that we are really in a good place right now with the percentage of vaccinations we have, hospitalization stabilized, community being very responsive, to be at nearly 93% in our state of people who have initiated one vaccine is a real testimonial to our people. And I think in return, we just need to need to do our end of it, on our end of it.
Yeah, I'm glad that you're being, somewhat aggressive, Mayor, because I think that the vaccinated population wants us to be a little bit more aggressive in how we handle the reopening. And, and everybody knows that, I do feel that the governor is just too cautious. So it's important that, someone or some people push him along the way, because if the governor waits too long, then we're going to be behind the curve. I mean, we kind of already are behind the curve. So I think it's really important for us to continue pushing and to be aggressive. Because you balance, pardon?
No, go ahead. I'm sorry.
Because I think you've done a really good job in balancing the metrics with the reopening protocol.
Well, thank you. Look, I mean, just plain speak here. We've all been seeing stadiums packed with people in all kinds of cities across the country, and many of those states have, don't have the vaccination levels, and they have cases and they have hospitalizations, but everybody's going about their lives. We've done everything here. We've been extremely cautious, I think. So to that end, I think we're at that moment in time. And I'm really grateful to be able to say that, because it was only 5 or 6 weeks ago, going into the Labor Day weekend, we weren't talking about October being anything close to what it is. And so given our reality, we want to respond on that basis. And again, you have to believe the efficacy of the drug and its effectiveness, and we do. And we think we're in a good place now to start really begin taking these early steps. And it may seem uncomfortable for some, but we want to push the envelope. I don't want to belabor it, but that's where we're coming from as a city administration.
Yeah, and my feeling is that the public is behind you, Mayor, and those who are vaccinated are going to be responsible in how they conduct themselves going forward. So I want to just thank you for providing the leadership.
Thank you. Thank you.
But yeah, so do the committee members have any questions or comments? Any questions?
Yeah, it's Peter. I have a question for the mayor. First of all, Mr. Mayor, thank you for your leadership. I think you've taken a very measured and appropriate response to all of this. So I just want to say I appreciate that. I know a number of people within the community appreciate that. My question is, do the most recent actions signal, at least from the City and County of Honolulu, a pivot for us at this point, where future policy will really be driven by those that are vaccinated and represent a much different risk profile to the community versus those that are not vaccinated and represent obviously a different risk profile? Because certainly seems like, given where the vaccine's proving out, that might be the smarter choice for us at this point.
That's a very astute question, Peter, because that's really quite honestly what's on the table, is we have to have the will to do that. And we do have the will to do that, and we have put a line in the sand. Quite honestly, I started with that when we told the city and county employees, irrespective of what the state did or the other counties, that we're going to mandate vaccines for all of our employees and not even provide testing as an option. Now we're to a different place here where, again, we have the benefit of nearly 93% already initiating. We really need to govern, if you will, with a majority and understand that, however that gets interpreted by the minority that doesn't want to get vaccinated.
Right. Agree 100%. Thank you.
Yeah, the only gray area in there, Peter, that is that the people who have legitimate medical reasons who are not able to get vaccinated, how they can establish that vis-a-vis, like I went to a restaurant Saturday night. I've not been out to a restaurant in a while, we had to show our vaccination cards and do that. It was all easy. It was very good. It worked well. And but those people who can't, for some reason, medical reason, or actually constitutionally, the lawyers in the room would say medical and religious reasons. But those people who have been granted those exemptions, how, where they fit in, because they're under test requirements. But so I guess that's the only thing they're gonna have to be able to show. That's why we put in safe access Oahu. If they want to go to these places as patrons 48 hours ahead of time with a test. That's the only thing that's a little bit that people may feel like it's a little harsh, but I think at the end of the day, that's what we're going to continue doing.
Thanks.
All right.
Okay, Lauren and Tina have questions. Lauren.
Thanks, Speaker. Thank you so much, Mayor. Just first off, I wanted to express our gratitude on behalf of Hawaii Food Industry Association for everything you've done, and we're very supportive of your Safe Access program, which we think really helped move the needle on vaccinations and is part of the reason why we're in the situation we are right now. So thank you so much for that. As you know, we put on the Made in Hawaii Festival, which is planned to be outdoors and actually was always planned to be outdoors. I know a reporter asked you a question about that yesterday and said it was indoors, but we are planning on having it outdoors, the entire fourth floor of the Ala Moana parking lot. So that's 140,000 square feet. And we were planning on masking, and we were planning on mandatory vaccination. And we were looking at having about 500 people every half hour. And hopefully having people shop in 2 hours and getting them out. So maybe around 2,000 people in 140,000 square foot outdoor space, November 11th. Do you think it's realistic to continue to tell the vendors we're going to be able to do that event? Or do you think we should postpone the event for a later date?
I think you should do the event. I'm looking at here, I'm getting heads nodding, you should do the event. But just to be upfront, if you're gonna have a food and wine festival, I can't imagine that really everybody's gonna continue to be masked there. But but we have it here, it says outdoor pop-up retail events. It says that the section applies to indoor and outdoor markets, craft fairs, and similar operations that operate like pop-up retail events are not otherwise covered under the order. These events are allowed to operate subject to general conditions, overall entertainment, etc. Yeah, you can do that. You should plan on doing that.
Okay, because we actually had told the vendors no sampling of food, so people could keep their masks on. But I mean, if we can lift that, I think that people would like that. And then we were also kind of wondering, can we have entertainment? Because we normally do entertainment. Do you have any thoughts on that?
Yeah, we'll try to make that happen. I can't give you the full authority right now. And this is the conversation we had earlier this morning. I was asking, what can I just say yes to unilaterally and let it be it? Turns out you've got to go through a bit of a process. But that doesn't mean we won't fight for it. It makes a lot of sense. And it's November 11th. That's a month away, a month from today, as you say. And I think a lot of good things are going to happen between now and then. And we'll take that to heart. We'll make it happen. But I would not cancel it. I would not postpone it. And that's the same decision, quite honestly, that we had to make last week on the marathon. And we looked at that and we said, I think the marathon date's December 12th, if I'm not mistaken. It's the 8th or the 12th. I got so many dates in my head. But we said that they need to know now. We need to make a call. We're gonna go. We're gonna go with that, and we've begun preparations. Okay.
Thank you so much.
Yeah, you're welcome.
Okay, Tina Yamaki, and then Cheryl Matsugo has a question.
Hi, Mayor. Thank you again for working with retail on this. Like Lauren said, we're really appreciative of what you have done in moving the needle forward on all of this, and especially not closing down retail again. I just have a very small request. On your One Oahu site, under the Oahu Response Plan under retail, it says 10 indoors and 25 outdoors. And I'm assuming you mean groups. My phone has been blowing up because people who go into these big box stores are calling me going, there's more than 10 people shopping in here. And I mean,
yes, no, it's groups going by.
Yeah.
Picking up 9 of your buddies and going shopping. That kind of, what I mean? Look, I realize that's ambiguous, but no, obviously the stores all along throughout. I mean, whether it's the big box stores, supermarkets, drugstores, whatever, they've always been that way. I mean, at one point I saw in Ala Moana people lined up going to stores, but there were still always more than 10 indoors, just not going in groups larger than that.
Is it possible to change the language on there that says groups? Because I noticed you have that on other locations, just to clarify. Yes.
Yeah, Tina, you're scoring in here. Everybody's going, yeah, we'll get it done.
And then I also wanted to say, I know you get a lot of complaints about what's going on and about personnel, but I really want to thank and publicly thank Molly Pierce from your Oahu when you call in. She has been just fabulous in answering our questions and having patience. So I just wanted to give a shout out to her and acknowledge all of her hard work she has done since day one that she's been there. Thank you.
Thank you, Tina. Molly deserves the praise. She's terrific. She's had a great attitude throughout. She's a tireless worker. And this is not the first compliment we've heard about her. And I'm so grateful to her because this has been a hard time for everybody. And people don't like being told either no or being told, what they can't do or whatever. And that's a difficult role. And she's handled it with great aplomb.
Okay. Is that everything, Cheryl?
That was Tina. I'm Cheryl.
Oh, Tina, sorry. I'm sorry. You're next, Cheryl.
Mayor Rick, good morning. Thank you again for being so open and meeting with all of us. The obvious question from the restaurants is, we're 2 days away from October 13th. When can we expect to hear an announcement so we can start getting geared up?
We're 2 days away from October 13th. What announcement would you like to hear from the Restaurant Association?
When are you going to be lifting the indoor, the 10 people, those things?
That's a governor's proclamation of the 10. That's 10 people in a given group indoors,
okay.
Right?
Right.
But and it's still at a 50% capacity. That's their proclamation. So right now, we can't lift that yet. I think we're going to look forward. I thought we made a good progress by getting the restaurants and bars to serve till midnight alcohol. We want to go forward. We need a little bit more time. I don't think they'll be tied to the 13th, but as I just said at the outset, Cheryl, and we're very cognizant of the restaurants. Please know that and what it represents. So. And I think Safe Access Oahu is something that is proven to be effective, and as it was already acknowledged, I think it's helped move the needle on getting vaccines and helping out that way. We've got a really good core concentration. So as we evolve here and the numbers continue to drop, we will continue to push on that. Not sure this, not lost on us just how important the restaurant business is to our economic recovery, and we ought to start sooner rather than later. And quite honestly, if anybody's on this call right now from tourism, it's not good having facilities right now not properly staffed, opened up, whatever else, and people coming here. We understand we got to get on with that. We do.
Thank you, Mayor.
So I promise you we'll stay on that. We'll try to lift that, try to get to 75% capacity or whatever else we can do to try to get us back sooner rather than later.
Thank you, Mayor.
Okay, thanks, Cheryl. Okay, Carl Bonham has a question, and then Rep. Bellotti.
So I just wanted to reiterate the gratitude to the mayor for the Safe Oahu program, and several people have mentioned the increase in vaccinations. So we're releasing results of a survey tomorrow that show this at the business level. That the business mandates have also increased vaccinations. And if you look at the actual vaccination numbers, the number of people completing their vaccination over the last week has been at the highest level it's been at since early August. It's about 130, 140% higher than it was the beginning of August. And if you trace it back to when that happened, the people initiating those vaccines, the peak was September 17th. There was about a 4-day period right around the launch of Safe Oahu and then also the program on Maui when the numbers of people initiating vaccinations jumped to a recent high as it's been since June, July. And so these programs are working. I'd like to see them tightened up even a little bit more, but I think they're making a big difference. So mahalo.
Thanks, Carl. Hey, since I have such great respect for you, sir, what do you mean by tighten up a little bit more? I'm not going to let you make that comment without a little bit more of an explanation. Go ahead.
Well, I'm not crazy about the only having to test once a week for employees who aren't vaccinated. I don't think that's fully effective.
Well, Cheryl will tell you this. Originally the DOH wanted 2 days, both front and end. I talked earlier about people who have exemptions. And the feeling from the Restaurant Association was they'd have a bunch of people quit on them. As it was originally, we wanted to have all vaccine, front and back of the house, because we knew at the time we were introducing all this stuff that outside of correctional facilities, restaurants, unfortunately, bars and gyms and theaters as a group were the second highest cluster. And we were trying to overcome the whole attitude towards restaurants. And that became a give on the backroom help, if you will. And Cheryl, please feel free to add to this. At one point, and I don't mind saying this, I don't know if Greg Maples is on the call, I went to the Restaurant Association and said, I'll get you 100% capacity if you give me 100% vaccinations. And they called back and said, we can't do that. We'll take 50% capacity because we can't get the backroom people to vaccinate. So then it was going to be a challenge as if we mandated testing, how many would they lose? And some have lost some. And Cheryl, you may want to add to this. But as someone said to me, have you ever really had a conversation with somebody who chops vegetables for a living? And I said, well, maybe I have, maybe I haven't. I don't want to sound pejorative, but some of the reasoning on some of these people is that just seems who seems to be populating some of the places. And we just figured, okay, we're going to impose testing. And that's probably as far as we can take it, short of having everybody walk out. So Cheryl, go ahead. I see you nodding.
Yes, exactly. Unfortunately, I have gotten testimonies and recordings of people just stating via email they've lost valuable employees, 20 years of employment and over this vaccination. And it's, one reason or another, as you know, it's either a medical reason, a religious reason. And unfortunately, you'll see it in the zip codes, especially when we look at the Department of Health, the vaccination percentages in certain zip codes, those are the restaurants that are really struggling to get employees. And so right now, this 7-day testing for my restaurants, we have to put them all up by 7 a.m. Monday morning for them to get scheduled for that week. Many of them don't even load it, so they don't get even scheduled.
So Mayor, I understand that this is a balancing act, and that's really where we are right now, right? We're at a point where we have to learn to live with the virus, and this is part of it. And really, I'm not the medical doctor, so you shouldn't take my advice on how often the tests need to be done. I was really speaking from personal preferences.
Sure. No, Colin, we don't disagree with you, and it's kind of going back to Peter's question or statement. And it's about having that kind of the will to be that way. And so that's where we are right now. And we're going to evolve, but we've drawn a line in the sand on vaccines in a positive way for the greater good. I hear what you're saying.
And Carl, we understand, Hawaii Restaurant Association was one of the leaders on the High Got Vaccinated. Many restaurants, as you know, threw in, gift cards and $1,000 and $2,000. Because we want everyone to be vaccinated. It's not that we don't want that. It's just unfortunately in some of the zip code areas of the lesser vaccinated, the employees, it's very difficult to get staff. But I will
say this, Cheryl, in support for what it's worth. I've not seen since, but the September 30th cluster report had 0 from restaurants, 0 from bars. First time.
Yes, thank you. Thank you. We're working on it. So the languaging and the communication is still get vaccinated. And we did a whole educational campaign on it. So we're continuing that. In fact, we have a webinar with the Department of Health next week, educating the restaurants again. So we continue the communication and the education. Thank you.
Okay, thanks, Cheryl. We have Rep. Bellotti followed by Ray Vera.
Thank you. Thank you, Mayor, for joining us. And I just want to echo what everyone is saying. I think it's so important that we're lifting restrictions and doing it in a smart way. I, for one, I'm on Zoom calls with my family weekly, and we're talking about signing up for the Honolulu Marathon. And we're looking forward to all the things that we can do as a vaccinated family. But with that said, I think one of the things that we saw with the Delta variant was that when restrictions were relaxed, we still had to monitor. And I think what I'm concerned about are not the good actors, but I'm concerned about the parties and the promotion of events that were not within the rules. So if you could comment on the relationship with the police and how we're going to continue to enforce, so that, yes, we're developing policies that focus on the vaccinated population and doing what's right, but do we still have that enforcement mechanism so that in the event that there are problems, there is a way to make sure that we can appropriately address those problems?
Okay, that's a great question. So on Friday, we made it really clear the events that we were sanctioning as far as large gatherings were structured live events being put on by professionals. That's true whether it's weddings, funerals, races, golf tournaments, or for that matter, the university hosting football games or anything else that we may do under these. But it's not an all clear. And the all clear is what you're alluding to with respect to, the rogue big parties out on a beach with a bunch of kids, 400 or 500 kids, whatever, some of these parties that have gone on. And that is an ongoing relationship we have with HPD to crack down on those. We've actually stopped. What's really been interesting is a number of people now track all this stuff because it's all on social media. And they've given us some really good tips, and they've been able to stop these things before they've started. It's going to be an ongoing battle going forward, though, because we know that that's just going to sort of happen, and people are going to push the envelope, and we're just going to have to try to monitor that as much as possible. But to the extent that we can provide, like you just said, because the marathon would be, you'd have to be vaccinated to participate, even though it's an outdoor event, is that we hope to be able to, in working with these professional groups, all of whom are trying to make a living and need to make a living, we want to be supportive of as part of our economic recovery. So on those levels, I think we're going to be okay. We're just going to have to be on the lookout for these rogue events, and they've been ongoing as it is. It's amazing to me. Some of the stuff is broken out demographically, and it's even broken out geographically and where it occurs, and we know that. And so I fall back again and want to say that we're at 93% about fully vaccinated, or at least initiating a vaccine. We're over 70% on Oahu fully vaccinated. That was a metric going into the 4th of July weekend that we talked about dropping all restrictions. I think Ray Vara is going to speak next. I think we are kind of to Carl's point as a community ready to go forward, live with this disease. It's not going to go away. We'll deal with those rogue events to try to mitigate them as much as possible. But I'm really much more focused right now on creating structured live events where people can go, feel safe, and start living their lives. So I don't want us to be held, I don't want to get extorted by the minority of people who really, quite honestly, threaten the majority because of their behaviors and have that becoming an inhibiting factor. So we're going to deal with that on the side. The major focus on a going forward basis is on what can we do and how do we do that as much as best as possible, especially with the holidays coming at the end of the year and the fact that we've been in this damn thing forever. We know how weary people are. And so we do want to move forward. I think it's the best I could tell you.
Thank you, Mayor. And that's so reassuring. And I also like to say I'm getting ready to sign up for UH football. So thank you.
Okay, Ray.
Yeah, thanks, Speaker. Mayor, I just want to also layer on with my appreciation for your leadership and the leadership of your team. I think your policy posture is spot on. Just on a side note, while I am extremely supportive of the Honolulu Marathon, I have not yet been inspired like Representative Bellotti to begin training for it and sign up for it.
Ray, I'll tell you what, if you sign up for it, Ray, I'll sign up for it. But I'll tell you, I ran one of those puppies in 1979. I threw away my shoes at Kapiolani Park when it was all done, asking myself, what the hell did I just do? I almost died doing that thing. That was
well, believe it or not, I've done it a couple of times, actually a few times, Mayor, and I still have PTSD from it. So you're going to get off the hook on this one. But again, I really do appreciate the posture of your policy, and I do think it's in the right direction in terms of conditioning our community to get us back to a point of our pre-pandemic resilience, which I think is going to be important. We've gotten used to I think as stress, is placed upon us, that we're looking for relief and policies and things to ease that burden. And frankly, I think in ways that we never would have in a pre-pandemic setting. And I think we need to recapture that resiliency as a community. I think this is a big step in terms of being able to do that. And I think it's also a big step in moving our community forward in terms of learning how to coexist with COVID. I think we all recognize, while we can talk about the surges and we can talk about the valleys, but COVID's not going away. The question is how impactful are we as a community at learning how to coexist with it? And I think policies like you're putting in place, recognizing the efficacy of the vaccines, is spot on. And so just thanks for your leadership, Mayor.
Well, thank you for saying that, Ray. But I'm sitting here in the midst of 4 key operators here, and Dana and Christian, our corporate counsel. Hiro Toyama's in the room, who runs emergency operations, and Mike Formby. I mean, we've talked about this stuff. I mean, it's been, don't take this the wrong way, it's probably the wrong way to express it. It's been a major distraction. It's been more consuming, given all the operational things we've had to deal with. But we felt all along in our discussions that we're really making the right and the balanced decisions, and want to act responsibly. And I just want to echo one thing. We could talk a lot about our public health, in the role that the city plays, which really is germane to the case counts, if you will, and hospitalizations and stuff. And of course, economic recovery has become now a major issue for us. Will be. I think it's going to redefine our entire administration. Just this morning, we had over an hour robust discussion on the opera monies and all kinds of other things we're looking at. But this is about getting businesses back. So the overall economic recovery. But the other thing is the psychological health of our community, and we know the manifestations of that with respect to whether it's childhood obesity being up 25%, depression, suicides, divorces, domestic violence, you name it. All of that stuff has been exacerbated because of this, and anything and everything we can do to start to alleviate pressures in those areas, not that we're the be all end all, but I think for the greater good and for overall, releasing some of the things that we've been held back on is going to just help. And we understand that, and we're sensitive to that. We want to also be a part of that stimulus in getting us back to our lives, because we're going to have to live with this disease for some time. We all know that.
Yeah, Mayor, I think that's a great point. And I think, given where we're at this point in the in the course of the pandemic and the course of the vaccination rollout, I think the much greater risk to the public health of this community are those social economic factors beyond the virus itself. And so it's great to hear you say that. And again, I appreciate your leadership in that regard.
Well, I know Peter's on the call, and I always go back to Bank of Hawaii sporting that first thing with the AUW when I saw my very first ALICE report. That ALICE community and the strain, if you start talking about how, and I think Della alluded to it, but zip codes and stuff, but there are a lot of people here. The oppression of this thing has not been equitable. There are people who have really suffered through this in ways that we've not lost sight of, and we've tried to do whatever we can to mitigate. I'm so proud of our team. We just talked this morning again on the rent utility relief. There was an article yesterday. It didn't even give this administration any credit per se, but we were recognized by the U.S. Treasury at one point as the best city in the United States on rent utility relief distribution. We're certainly in the top 3 of the whole country in getting out what amounted to, I believe, over $80 million thus far to some 8,000 or 9,000 families. And when they lifted the eviction moratorium, they were surprised. That was the article yesterday, Mediation Center of the Pacific, and how few filings there were. Well, that was a mitigating factor that we did. And that's, and I'm not saying it for any self-aggrandizement. I'm proud of our team for figuring that out. And they figured it out in ways that other people couldn't get it done all across the country. So we're very much in tune or in sync with just how damn tough this disease has been on people. And some people it's been a lot tougher. We recognize that. And anything and everything we can do is where we're coming from.
Okay, Dr. Mugishi has his hand up.
Hey, Mark.
Yeah, thanks, Mayor. I want to echo everyone's thanks for this, and I don't want to reiterate the importance of our socioeconomic recovery on public health, because I think we all know that. Except to share just the story of Detroit, right? Which, you know, maybe 20 years ago was when they had the crisis around auto manufacturing. And now 20 years later, we look at their data. And if you live in East Grand Rapids, you have a life expectancy of 91 years old. And if you live in urban Detroit, your life expectancy is 62. And I think that 29-year discrepancy is a humongous reminder of what we can't forget that we have to accomplish in the next year or so in order for us to avoid that catastrophe. So thank you for your leadership, Mayor.
Thank you, Mark. That's a really good point. I think that's, again, more eloquent than me, but that's what I was trying to say. We actually have a feel for that. We understand. That's why we want to do anything and everything we can. Look, I would tell you the one thing I'm really proud about on the rent and utility relief, we went into it, we said we need to do this equitably. And we set up mapping. I wanted to be sure that we were giving out monies across the island, especially on the west side where we knew the oppression was really strong despite the low vaccination levels. And we wanted to be supportive of that because we had looked at actually prior distributions of CARES Act money. It wasn't done equitably. And I think the one thing I can say is that we have done this pretty well in an equitable way in direct correlation to what you just said, Mark. We get it. We understand that. Thank you, though, for the compliment. I appreciate it.
Okay, I think that was the last person who had a question. So Mayor, I know you have meetings, but if you want to stay on, the next presentation is from Carl Bonham. He'll just give us an economic update.
Yeah,
So you're welcome to stay for that.
We've got some time. I think our guys would like to hear. It's always special to hear from Carl. Okay, he's like the Wizard of Oz. You know, he's got all this stuff and all this great information. It's always good.
No pressure.
Okay. All right, Carl.
Thank you, Speaker. And I'll reiterate some of the things that we've been talking about as I go through this presentation. You know, the Hawaii situation today is still one of you know, really needing a tremendous amount of recovery, and I think some people lose sight of what's been holding the economy together. And it's certainly not job growth. Jobs are still down 14% from where they were before the pandemic. This is all quarterly data comparing the second quarter of this year to the fourth quarter of 2019. Real GDP is still 7% below where it was. Labor earnings, right? So this is income of households without all the transfer payments, still down over 5%. But if you look at the total real earnings, total personal income, it's up 3% because federal transfer payments grew by 47%. And so we were talking about the Alice households and sort of the pain being suffered disproportionately. Well, it certainly was suffered disproportionately in terms of the jobs, but the transfer payments made many of these households whole over the last year and a half. And the crisis for many of these households is actually just now beginning, or it's beginning in a much more pronounced way because the transfer payments are going away, and the job numbers are not positive either. This is the green bars are number of payroll jobs, and the blue line is a line you've seen over and over. That's the UHERO Economic Pulse, which turned down long before any government announcements about restrictions. People started restricting their mobility. We saw the extreme drop off in tourism mostly in August and into September. And the September job count, which we don't have yet, we expected to show a loss of another 6,000 to 10,000 jobs over and above the jobs lost in August. The good news is that the index has begun to turn up, and it's turned up because of mobility. So as Delta has started to back off just in the last week to 2 weeks, mobility has started to turn up again. And this sort of gets to the need to learn to live with the virus and to maintain that care and the masking and having events that are well managed, because as the mobility goes up, there's of course a risk of additional spread. But the point of getting back to the needy and the people who have have lost these jobs, it's happening at a time when federal support is gone. These were continuing claims for the federal unemployment insurance, so the PUA program and the PEUC program. And so we've gone from 50 to 60,000 people having weeks claimed, and these are actually weeks claimed, and now it's essentially zero. And if you look at the numbers on what's happened to transfer payments since the first quarter of the year, between the first quarter and the second quarter, about $2 billion was shaved off of federal transfer payments, because in the second quarter, we didn't get, the unemployment benefits were reduced a little bit, and all the direct payments to households went away. And we expect another $750 million decline in transfer payments in the second half of the year. And almost all of that is unemployment benefits. So combined with the end of the federal programs, there's also the end of the plus up, and that amounts to what we think is close to a little bit less than $1 billion in decline in money flowing into the state economy in the second half of the year. The good news, of course, is what we've been talking about all along, is that Delta's impact should be temporary. And we brought the hospitalizations down. Things are beginning to sort of plateau. The total hospitalizations over the last 4 or 5 days have flattened out. The new hospitalizations have flattened out. The CDC projection from last week, they do these every single week, and they've been showing that new hospitalizations and new case counts will continue to decline. Really, for the last month, they've been predicting this exact path, actually over-predicting some. And to put this in context, and this gets back to, again, needing to live with the virus, the level of hospitalizations are below where they were when we announced safe travels, when the governor announced safe travels back in 2020. And so really we're at that point of beginning to open up, as the mayor has talked about, and doing it in a safe way so we don't experience another surge. Even with the temporary nature of the impact, it still is costly. So this was our forecast of visits. So essentially what I'm showing you is 2019 visitor arrivals, 2021 visitor arrivals. This is actual arrivals. This is what our forecast was in the second quarter. We of course, as most, were very much surprised by the extent of the pent-up demand. That was the forecast we released just about a month ago, and this is what the picture is looking like now. I think there's some reason for optimism that the fall is going to surprise to the upside, particularly when we think about the fact that we're going to likely have a Honolulu Marathon, and we're going to have these relaxation of restrictions. And these changes mean putting people back to work. It means people whose hours have been reduced will get them back, and people who lost their unemployment benefits will have a much, much better time finding the work they need. Whether or not the outlook ends up being consistent with our optimistic outlook or the baseline or the pessimistic depends on how we handle the pandemic, right? So if we open up with relaxed restrictions and are careful and maintain good protocols so that we don't have another surge, and we continue to add to the vaccination, the numbers vaccinated, then the optimistic scenario is much, much more likely, which gets us back to closer to where we were pre-pandemic by the end of the forecast. Mahalo.
Okay, thanks, Carl. So we'll open it up for any questions or comments. Any questions? Okay, if not, the next presenter, the next presentation is the medical update. So we have Dr. Mugishi, Rayvara, Dr. Green.
Well, if we're going to go in the order that you just said, Speaker, I guess that means I'm first. I guess the main point I want to make is that when you talk about public health, And when you talk about the health of our community going forward, Carl's presentation is the definition of public health. We've had to, during this whole pandemic, we've had to balance the acute infections, which pose an imminent threat to our public health, with these long-term impacts. So we're at the point now where we have, at the moment, pretty good control of the imminent infections. But as I shared earlier, this threat of the impact to our public health of the future is not imagined, it's real. And I can say that because we're at the point now where 60% of our families are either ALIS or below. And from our standpoint at HMSA, we can see that more than 50% of our kids are Medicaid. They're part of the Quest population. And when you look at that in aggregate, that does not bode well for our future of public health. And that's why we have to pay attention to Carl's presentation and say, that is what we need to address if we care about the health of Hawaii. So with that, I'll turn it over to Jill and Ray.
Ray, do you want to go next?
Either one, go ahead. Okay, thanks, Jill. Mark, I don't have a whole lot to add, and I know, well, I appreciate you leaving it for me to say, because we brought in a speaker who we both heard it from, but a couple of years ago, Mark and I and some of the others on the call heard Jeffrey Canada, who founded the Harlem Children's Zone and did such an amazing turnaround of that community, share with us what I think we've all been saying, and that is that that poverty is the greatest enemy of health, and the slower we are to respond, the greater the challenge that we create in that regard. And so it's time for us to get back to work and bring that resiliency back to our community. And further, I think Mark really gave a great example when he talked about what's going on with life expectancy in Detroit. But we can see that right here in our community. With the most recent data that I've seen, the life expectancy difference between Hawaii Kai and the west side of Oahu is in excess of 10 years less. The difference between Hawaii Kai and Waimanalo is just about 12 years less in Waimanalo than it is just around the corner in Hawaii Kai. And so we have those same issues facing our communities, and it just tells us that zip code matters. And as it relates to the way the pandemic has affected our community over the course of the last 18 months, zip code matters that much more. There's been a lot of talk about hospital capacity and not wanting to stress the system. But I guess I need to share that, look, our systems have been stressed before. In fact, on an annual basis, our systems are always stressed during the January, February, March months as we are exposed to the flu and we're exposed to other diseases that come onto our shores. And this isn't to compare COVID to those diseases or those viruses, but the truth is we have the ability as a health system to withstand a fair amount of stress and be here for the community during the time of greatest need. And you can count on us for that, so that we can tend to these other public health issues that are really beginning to plague our community and require swift action. And so I'm very proud of the team here at Hawaii Pacific Health and Jill's team and the other healthcare providers across the state for the work that they've done. But just know we've got broad shoulders, and we can handle the stress that comes to the community so that we can get to work on addressing these other issues. So thanks.
Thanks, Ray. Dr. Green.
Thank you for this great opportunity. And I want to again thank you, Mayor. You've been with us, supporting us through this entire journey, particularly this last year. And we truly appreciated the way you have been thinking about what helps us actually improve health, and focusing on, as it relates to COVID, it's vaccinations. And we know that. Ray just described the health disparities and health inequities we have in our community, and there are many. As an organization that's deeply committed to improving health and well-being here at Queens, we actually took on an aspirational goal to focus on reducing reducing the gap in life expectancy, because we could see such a difference between certain individuals and certain groups within our communities. And social determinants clearly are an impact to that. COVID has actually differentially impacted individuals that have those health inequities already. So for us, the focus on how do we work over the next 6 months as we think about living with COVID and living with any disease. We know that the most important thing here is vaccinations. So continuing that focus is going to be critical. I was looking at our data, and over the last 2 months, we've cared for over 1,000 people in the hospital with COVID. And the death rate has been high. There's no question this is a devastating disease, and the Delta variant was actually worse than the variants that we have seen in the past. And your work to help us mitigate that for the last 2 months has been extraordinarily helpful. And as I was looking at data, I could look back at September 3rd, it was just less than a month ago, just basically a month ago. We had 447 people in our hospital, respective hospitals, battling this disease. Today, that number is 147. For us here at Queens, we had our highest numbers were 167 people. That was around September 5th. And today we have 69. So we still are caring for a majority of patients that have COVID. What is really important is that we keep aligning all of our public health measures around encouraging vaccination, because we know that there was only 15% of the people that got seriously ill had already had their vaccinations. And it was the far majority without them that actually experienced this devastating disease. We are moving forward, and with vaccinations, with our ability we've learned a tremendous amount through this pandemic about public health, about social determinants of health, and ways that we can prepare ourselves to even be stronger as a community. And I look forward to a lot of debriefs over the next several months about how do we improve our public health from social determinants. We have significant issues with housing. We have significant issues with poverty. And how do we assure that we create the safety nets to support that? And within our health systems, how do we strengthen our health systems? Well, they are good. There were periods where we did not have enough ICU beds across the state. We did not have enough nurses. And if you look across the country, we have increasing shortages that are going to be significant, not only here, but throughout the state. I believe that we have, if we take what we learned from the pandemic, when we all leaned in, when government, our health systems, our schools, our community, our private communities, when we lean in together, which we did better than any other place in this country, there is nothing we can't take on in terms of improving. So I would love to see a decade from now, and this is actually a goal that we have at Queens, we want to do everything we can in partnership to reduce that gap in life expectancy by half in 10 years. Most epidemiologists would say that's impossible. You can't take, whether you say it's 6.5 years or whether you say it's 10, depending on who you're looking at. They would say it takes a whole generation to reduce those kinds of gaps. I don't believe that. I believe if we're partnering with our schools, if we're partnering with our industries, and if we're partnering with our health systems, we can do so much more. So, Mayor, thank you for your leadership. And I want to also thank the governor. He's been with us for this entire 2 years. I'm hoping that we can walk past this and actually be prepared for the next, because there will be more pandemics. We're going to be a state that can manage those effectively. But I look forward to seeing health and well-being. I look forward to seeing the life expectancies continue to go up in our communities, and that particularly for our keiki, that we are very focused on healthy mothers, healthy keiki, and that our keiki have the very best support to make sure that they can have the life well lived that they deserve. So thank you for helping us through this. And we look forward, all of us look forward to a much more successful year, the coming year and coming years.
Okay, thanks, Dr. Green. So it's 11, so we're at the 1 hour mark. So just want to thank everybody for joining us this morning. We'll probably be notifying you about the next meeting to be determined. But again, thank you for all of your work, and we'll see you next time. Thank you.
Thank you.